I had asked Dr. Levine, Dr. David Levine, who you all know is he's the chair of our neonatal initiatives for GaPQC, and I was going to have him go through just some welcoming remarks, and then also just giving you a sense of which hospitals we have participating in this initiative.
Thank you, Katie. Well, first of all, I am just extremely excited, just as Katie is, at the extent of participation. This is our largest neonatal initiative ever, and as Katie moves the slides here, you can see that we have 44 hospitals, and we're covering 66% of Georgia births. And just to give you an idea of who's participating, there you have it by levels. If you look across it, about half of all the hospitals in each level are participating, except for the RPCs, in which case 100% are participating. So that's pretty good. We still have some room for improvement, and we can still enroll some hospitals. And if you look at it by region, anywhere from 33% to 82% of hospitals in each region are enrolled. So shout out to Macon for getting 82%. So that's really good. Well, for those of you who may not have been at the annual meeting a couple of weeks ago, and for those of you who were, a big shout out. Thank you for making it the biggest ever. You know that we decided to pursue NAS statewide a while back, and we had several options as to the platform we were going to use to do that. And we chose Vermont-Oxford Network Universal Training. And could we please have people mute? There's still several people who are not muted, and there's a lot of noise in the background. We chose the Vermont-Oxford Network Universal Training platform for several reasons. One of which is that they had already engaged in a nationwide collaborative on NAS several years ago, and across that collaborative had produced a 2-day decrease in length of stay, about 10% decrease in length of stay, decrease in pharmacologic treatment, decrease in babies going home on medication. Also because if you're familiar with Vermont-Oxford Network, you know that it's a network of over 1,200 hospitals worldwide engaged in collaborative learning with data-driven QI and research. So the program for doing our NAS initiative is based on the Vaughan Universal Training, which is done through their learning management system, which you're going to hear about in a few minutes. We'll have monthly webinars, as Katie mentioned, which will follow the modules on the learning management system. Those modules are relatively short, easy to complete. We'll want you to complete them in your hospitals, either all together, you team all together, or if that's not possible, complete them individually before the webinar. And then we'll, on the webinars, we will use those topics as a platform, and we'll have speakers about those topics. We'll discuss those topics. We'll discuss where you are, and we'll have some QI training along with each webinar. The data we'll be collecting will come from two sources. One will be from the audits, which you're going to hear about, the Vaughan Day audits, which we'll conduct 3 times during the initiative. And the other one will be from some data that DPH is going to provide.
Sure, that's what we're trying to get in.
Okay, can you please mute? So without further ado, now that I've mentioned the learning management system, I'm going to introduce you to John McGregor, who is the director of the learning management system for Vermont-Oxford, or the manager, learning systems manager, and he's going to tell us all about the logistics of how we use the learning management system. Vermont-Oxford has a great number of really useful tools, and even better than that, the folks at Vermont-Oxford are so helpful and easy to work with. I think if you haven't experienced this before, it's going to be a pleasure for you. So without further ado, let me turn it over to John McGregor.
Hi, yes, can you hear me?
Yes, we can hear you.
Great.
Yes.
So Will you be moving the slides, or will I have control?
I will be moving the slides for you, so I'll watch for the pause, but let me know if I've missed it.
Sure, yeah, I'll let you know, definitely. Well, hello, everybody. My name is John McGregor, and it's a pleasure to welcome everybody to a universal training solution aimed at improving outcomes for infants and families affected by NAS. And today, I just wanted to provide you with an overview of our learning management system, as well as discuss everything that you'll need to launch a successful implementation from the NAS lessons to the Vendée audits. So your teams, and you can go ahead and, thank you. Your teams will come together and we'll do a lot of learning. So you'll have some excellent tools for measurement, both with the Vendée audits, as well as your local measurement initiative. And you'll structure PDSA cycles to test the potentially better practices that you'll learn about in the NAS lessons and the toolkit. And you'll have many opportunities to really share and learn from each other, but your ultimate aim is not just change, but measurable improvement. You can go to the next slide, please. And we, again, just like David had said, have been working with many other states across the country with NAS, dating back to 6 years, and most of those centers have made tremendous gains, and we've also partnered with multiple other states, recently the Maryland Patient Safety Center, who implemented for the last year and completed over 35,000 certificates for the learners who are working in that particular state collaborative, over 33 centers. You can go to the next slide. But you certainly really don't need me to tell you about the opioid epidemic, and we all have been hit hard by this, and the number of maternal deaths and the number of NAS admissions are growing exponentially. And the CDC, I'm sure you know, has declared that we're truly in the middle of a full-scale opioid epidemic. You can go ahead to the next slide. So what do we need to do? Well, we're going to talk today about collaboration and universal training. And you're kind of familiar about the idea of this universal training because you do so with NRP. And until we all got on the same book, got the same manual, did the same training about how to approach babies who are depressed in the delivery room, we had extremely variable results. But once the Academy of Pediatrics came out with this idea of universal training, where everybody trains for a predictable event, the outcomes improved. So we're really testing this proposition of universal training around NAS. And our first aim is to engage centers in a multi-center QI collaborative focused on improving the quality, safety, and value of care for substance-exposed infants and families. And our second aim is to promote the rapid cycle adoption of the AAP NAS guidelines into clinical practice by standardizing NAS-relevant policies and practices. Next slide. When really, once these guidelines are published, it takes really a while for the babies to benefit. And there's a lag between when we know what those potentially better practices are and when they're widely adopted. You can go to the next slide. And really surprisingly, it takes 15 years for the evidence to reach just 50% of the patients who would benefit. So in this year, we really just can't accept lags like that. So that's why using the collaborative statewide implementation for this universal training really is the best option. You can go to the next slide. We also know that over half of infants who have full-blown symptoms of NAS are not cared for in a NICU and probably don't need NICU care. They're cared for in community hospital settings, but it's important that regardless if they're in a metro or a rural setting, that every baby gets the most comprehensive treatment possible, so that's why we really focused on this universal training. And our potentially better practices, the toolkit, and all of the content you'll learn in the lessons came forward by this amazing international scientific steering committee and faculty. And these are just some of the names and the faces that you'll get familiar with as you work through the lessons together. So you'll be encouraged by your state and center leaders to look at these potentially better practices that we'll look at a little bit in the toolkit. And really what a potentially better practice is something that's based on good evidence and its demonstrative effectiveness in other settings. But you won't know that a practice is truly better until you test it, adapt it in your local context, and really measure that practice so it sees that you're achieving the same results that others have. So you'll be doing these small tests of change to roll out something new. And in addition, I'll talk about, we also have some resources for our quality improvement resources and lessons that'll really help you get the universal training for NAS as well as get a really foundational QI knowledge. So I just want to go over, before we really get into it, just a little bit kind of about the rollout of the universal training. So today we are doing our NAS universal training webinar. And really between now and June 1st, it's all about the first steps of getting started. So we're working on finalizing the final paperwork, and then we will work to get the participation agreements that have been completed by the centers by June 1st. So what we'll need to do is all of those agreements will be going to Caitlin internally, and then we'll work with her with the information so that she can get those paperworks to us so that we can get everything set up for the bond day audit that is in July. And I'm sorry, that's July 8th, not 9th. And we do have another audit in October. I know that you're shooting for the July audit, but if any participation agreements arrive after June 1st, they'll just be included in the next audit. But it is important, if you are shooting for that audit, to try to work with us to make sure we have everything prepared. And again, all those paperwork will go directly to, I believe, Caitlin internally, and then we'll work. So we'll have our contact information up again if you have any questions at the end of the presentation. And then from June ongoing, we will enroll and have the users start working in the online learning. Again, they'll share this training where we go through all of the steps to how to log in and access the training, but we'll also share other short videos that show how to do that as well, and ongoing resources. So the audit then will run in July, and then after the audit will be the ongoing implementation. So like David had indicated, through the monthly webinars, working through those lessons, and we'll also be communicating with David and Caitlin ongoing reports, just how things are doing, and different ways that the champions can motivate users to complete the lessons based on what we're seeing at each of the centers. And then over the next year, it's really just working to complete the lessons. Again, we'll be sending monthly reporting that you'll see how your centers are doing. It'll have the lesson completion. We'll report centers that have achieved what we call a center of excellence, and we'll talk about that a little later, which is optional if centers would like to go for that. And we'll highlight use in progress and share some motivation ideas along the way as well. And then your second and then your third audit will occur during the times that we've scheduled, but the last one will occur at the end of the 2-year implementation in 2021. And then at the end of the implementation, all of the centers that have achieved the Center of Excellence will report that back and then package it up in a nice little media package for you to share. So before we get into the lessons, I do want to talk about the Vaughn Champion role, because the Vaughn Champion is a role at each center, and they're really the champions as well as the coaches and the cheerleaders for the team and the core team and all the other users. Again, we'll mention in enrollment, if you'd like to enroll as many users at your center you can, but when you're enrolling the users, you have the ability to identify your core team. And this core team is someone that the Vaughn Champion is really going to champion and cheerlead, that is involved in the day-to-day practice, someone who really interacts regularly with the team, maybe a lead role or administrator. And they're also the person, if you go to the next slide, who will identify the users to be enrolled. They'll be the ones to really be the super user on the LMS, working with us if they have any questions on how to navigate, so they can answer any questions right there on the ground directly to the users who are working on the content. And then they'll work with us as we send our monthly reports and motivation tips on ways to keep users engaged in the content. Now, I did mention a Center of Excellence. We do have this optional for centers. Obviously, it's a great way to really identify your core team and then ensure that that core team has completed all of the lessons and is using the lessons in the day-to-day work. Again, on the enrollment spreadsheet, there'll be a column where you can identify which of the core team you would like. It's a minimum of 25 users for the core team. If your center enrollment is under 25 users, whoever you identify as your core team, if you identify 10 or 11, those users just have to complete all of the lessons. So you'll just identify a core team, and then you can enroll other users if you'd like to have access to the lessons, and they'll have access, but if you don't identify them as a core team member, then they won't show up on the monthly reports. But this is also a good way if you'd like to provide the content to, more widely available to maybe some users that you might not want, additional to your core team that you just like to open the content to. And then each month we'll send a statewide report that shows the progress. So we'll have a graphic that'll show the amount of users that are enrolled and then the amount of users that have completed the lessons. And we'll track based on each center how close the core team is to completing each one of those lessons. And once all of the core team at each center completes the 18 NAS lessons, we will indicate that that center has become a center of excellence, and we will mark that on the monthly report, but we'll send out the final recognition at the end of the implementation. And there is a way for the state to achieve the state of excellence, and that's really when 85% of all the core teams enrolled in all of the centers complete the lessons, then we'll identify the state of excellence. So again, we go over the Center of Excellence in a little bit more detail. If centers would like to participate, we do have information that we'll send out, and it'll have all the information on exactly what you'll need to do from enrollment to tracking as the users complete the lessons. But logging into the system is very easy. What will happen is once we have your center set up, we will send out an enrollment spreadsheet specific to your particular center. So each champion, once they're identified, we will send out an enrollment spreadsheet, and you will just be able to enter your users. There'll be a column there where you can just check off the users of who is going to be on your core team, and then uncheck or not identify any of the users who are not on the core team that are just open to the content. And we'll enroll those users into our system, and then we'll send them an email that will have videos and instructions on how to access the content, the lessons, and then complete the certificates. And we'll go through all that today right now as well. So to do that, it's very easy. You'll just go to vtoxford.org/LMS, and then click on Forgot Your Password. And then after that, you'll get to a screen where you'll enter your email. Now, the email is the email that your Vaughn champion submitted on the enrollment spreadsheet, and you can always contact your Vaughn champion or us at support@vtoxford.org if you need to know who your champion is. And you'll just click Get Password. And what will happen then is an automatic email will be sent to you that will have a link and instructions on how to set your password and then log into the system. Oh, you can go to the next slide there. Yep, so you'll get an email there. It'll have a link, and then you can click it, and it will have all the instructions to set your password and then log in. And then each time after that, you'll just go to vtoxford.org/learning, and then click on the option for Login to edX. edX is our online learning system where we have all the lessons. And then it'll ask you to enter your username and password, and you'll do that and click Login. And then you'll see this tile here for the Universal Training Program for NAS. It contains 19 micro lessons. There's 18 that generate credit, and we're working on a bonus non-credit generating lesson that's focused on Eat, Sleep, Console that we're hoping to come out with in the next few months. And you can just click Go to Course Homepage. And when you do, you'll see a group of lessons. There's 18 lessons. Each one of them is represented by a small tile, like you can see there. So you'll see 18 of these little boxes. And to access a lesson, you'll just click Go to Lesson. So we'll provide you in the welcome email, and we'll send out that you can share after this if you haven't already, a list of all of the NAS lessons. And if you are scheduling which lessons to view at certain times, you can just add the titles, and when they log in, the users will find the lesson and then click on that option to go to the lesson. And then when they do that, they'll actually hop into our learning system, the edX platform, and it'll see a screen that they see here. We have an icon here directly that they can access the toolkit. And then when they click that toolkit, it'll open up the toolkit that we do have. And the toolkit has just a wealth of information, as well as the different potentially better practices that we focus the lessons as well as the audit. So if you click the toolkit option there and just go to the next slide, I have just a screenshot of the potentially better practices here in the toolkit. And one of the key components are these potentially better practices, which really the curriculum is organized around. And if you click the slide, I think it'll highlight the first one that we have, the potentially better practice. Yep, the first two. And potentially better practice one is to develop and implement a standardized process for the identification, evaluation, treatment, and discharge of infants with NAS. And potentially better practice two, developing and implementing a standardized process for measuring and reporting rates of neonatal abstinence syndrome and drug exposure. And certainly, really, the Vendée audit is going to help with that. But in addition, just want to remind you that you can also use your state and local data to plot the dot to really understanding what's happening day to day with NAS. And we'll just look at a few of the other potentially better practices. Really one of the most important that we feel is to create a culture of compassion, understanding, and healing for the mother-infant dyad affected by the problem of neonatal abstinence syndrome. And we really encourage all the Vaughn champions to look through the toolkit. The toolkit goes into depth into these potentially better practices. It gives you different examples of different SMART aims, different ways to measure, different key driver diagrams that you can use. And it really helps to facilitate the learning and then complement the learning as you're working through each one of the lessons.
Isn't that hilarious? Yes.
So to start the course, at the top, you'll just click the course tab, and there'll be a big blue button that will either say start or resume course. The good thing about the system is that once you start it, that start course turns to resume, and when you click it, it'll pop you right back in to where you were before. And then every lesson is going to start with the recorded sessions. There may be one or two recorded sessions, as David indicated earlier. They are very segmented lessons. They range from anywhere from about 20 to 25 minutes. A couple of the lessons are a little longer, but we always segment the videos in 15 to 20-minute chunks, so you can work through those bit by bit if you like.
Somebody needs to mute, please.
Oh yes, if you don't mind muting, that would be great. And then under the recording there is a link for any of the handouts that we have. There's also a facilitator's guide that you can click at for some of the virtual video visits that we have. And if you go to the next slide, we can share. This actually has a short clip and we're recording, but we'll share that after the presentation. And we have 5 different chapters of a virtual video visit that's integrated within the 18 lessons. And in the virtual video visit, we had the opportunity to go to Vancouver and visit a center of excellence. It was in Vancouver's east side in a neighborhood with a high degree of drug use and abuse. And we worked with an outpatient center called Shiwei, and in these different virtual video visits, it really goes on to tell the mother's story and present a unique model of really what's spreading around the U.S. And to complement this, we have the facilitator's guide, and I encourage the champions, and you can go to the next slide, yep. And the facilitator's guide, and if you go to the next slide, you have a shot of the table of contents. It breaks up each one of these lessons into different curriculums that you can work through as a group or center by center that really dives into the content. So it's just another excellent resource to help you really engage with the content as well as motivate the users working on the lessons.
John, let's pause a second. Could I ask you folks to please check your phones and make sure you're all on mute? because there's a lot of background noise. Please. It's not fair to John or the rest of us.
Thank you. We also have for each of the 18 lessons the ability for the users to earn ongoing medical or nursing credit. So after the videos play, when you click Next, it'll bring you through a three-part process on how to get the certificates. There'll be some post-test questions, and you can go to the next slide, and then you'll complete an evaluation. And then if you go to the next slide, then it'll ask you to select either your nursing or your continuing medical certificate. And when you select those, you'll be able to generate a certificate that you could download and you can print. And the next few slides really just show how you can click to request and view your certificate. And then you can print those or save those, and it will all archive within your account when you log in. So you'll have really a running transcript of everything that you've done. And I did mention before that we also have some additional lessons that we're going to make available to you. We partnered with the IHI and worked to get and lease some of a course that was provided through Harvard's online learning site, HarvardX, the Practical Foundations in Improvement Science, which are 8 micro-lessons that focus on building really a universal training in QI knowledge, from starting with developing SMART aims to developing a key driver diagram to then tracking progress each day and then looking at those iterative changes and then making decisions on how to improve. Some great resources and videos that go over different ways to track progress. So if you are using the NAS curriculum and these at the same time, you can always work to build those PDSA cycles to work and move through your improvement work. So when you log in addition to that NAS tile, you're also going to see another tile, which you can see here, that brings you to those 8 lessons. And again, for the state leaders and the Vaughn champions at each center, I encourage you to review the content in these lessons so that you can work together with your teams to develop ways and plans on how to integrate some of these lessons and learning into small iterative changes to help your improvement work. So again, once you click, you'll see the 8 lessons there, and you can just select each one. And there's a toolkit as well that has some different video resources that may be helpful. So it's just a great course that has really helped some centers that we've worked with leverage a universal training in quality improvement. And we wanted to provide those to you as well. And before we moved on to the next section, I'm going to turn it over to Courtney, and she's going to talk about the Vendée audit. But I just wanted to pause to see if there were any questions, and we can just take a few minutes, and I know we'll have some at the end as well.
John, this is Becky Charrington from Piedmont Columbus Regional. I'm assuming, but you know what it gets you when you assume, that we will be able to have access to these slides after this presentation. Is that correct?
Yes, yep. I've emailed the slides to Caitlin, and she can definitely email those if that's fine. Fine with us.
All right. Thank you very much.
You're welcome. All right. Well, I know that we want to just make sure, because I still have a lot of important content to go over, so I definitely want to pass the baton over here to Courtney Scott, who's our Vendée Audit Coordinator, and she can talk to you about the Vendée audit.
Thanks, John. So next slide, please. So the 2 audits will be performed. These are not on-site audits. I just wanted to clarify because it's confusing. Some folks think that we're actually going to go out there and audit you. It's something that's done by you. Your data is collected and entered into a web-based portal. So,
excuse me, can everybody hear Courtney?
No, we can't.
I cannot hear.
No.
I'm sorry. Is that better?
Yes. Thank you.
I apologize. I was trying to stay muted. All right. So there would be 2 audits that are performed, which are done with a web-based portal. So we will not be coming to your site. It's information that you collect on your own and enter into that portal. The inclusion criteria are infants that are treated pharmacologically for NAS, and they have to be at 7 days of age or less and discharged during a specific 3-month eligibility period. And I'll talk more about that 3-month eligibility period momentarily. If you are, back one slide for a second. Thank you. The audits, you can have up to 30 infants. Some of these centers you probably have far less, but that's the most amount that we have for you to be able to enter in the audit. And you will have a copy of the Manual of Operations, which will be available in your toolkit in edX. Next slide. So your institutional review board is extremely important, their approval in this process. So the purpose of this project is really for quality improvement, and so most IRBs don't have any kind of issue with this kind of audit. However, we ask that you check in with your institutional review board just to make sure that they don't have any exceptions to it. And the data will not be broken down by provider or used to monitor individual actions. Next slide, please. All right, so there are 2 different parts of the audit. There's a unit level and a patient level. The unit level is mostly about policy and procedures for screening the maternal substance abuse, as well as comprehensive treatment of the infants with NAS, and what scoring tools you use, and different standardization of that scoring. Policies and guidelines for non-pharmacological treatments, such as eat, sleep, and console, and things like encouraging breastfeeding. Next slide, please. And with the patient-level data, the type of things that are measured, birth weight, gestational age, which kind of toxicological screening was performed. And I'm going to skip through this just in the interest of time. All right, so the results that are reported to centers, the total number of infants that are pharmacologically treated for NAS in the first 7 days, the total NICU length of stay, total hospital length of stay, total duration of pharmacological treatment, potential discharge delays, number of days after treatment stop to discharge, percent on mother's milk at discharge, medications used for treatment, and medications at discharge. So I was speaking about the 3-month eligibility period, and a lot of this is going to depend on when you guys will do the audit, which depends on getting all of the information back to us for the enrollment. So this eligibility period can be set once we know exactly when your audit window will be. And if all that information can be in by June 1st, then the audit window will be July 8th to July 12th. And we just suggest that the 3 months before the audit be the eligibility period. So all the infants that are within 7 days of life and discharged within and pharmacologically treated for NAS and discharged in that eligibility period should be included. So there's also the email address for Vendée support. So if you have any questions, please email or call that number on the screen. And I also can entertain any questions. Although I did want to mention, I know that we were talking about 3 audits. My understanding, and maybe I'm just not in the loop with something, is that there's 2 audits, one at the very beginning and one at the end of the universal training. So, and of course, you can still plot the dot with your local measure initiatives. So, but maybe we could talk offline to just confirm the number of audits with Dr. Levine. Next slide, please. So this is what it's going to look like when you get to the data entry portal. That link that's on the screen, if you enter that into your web browser, you should be sent to a place to log in. And the same login information for your password and username is the one from the LMS as well. Next slide. So you'll have 3 different options of icons to click once you get past the username and password. And you'll select the audit, which is the middle button. Next slide. And this is about what it will look like. The questions will be on there with buttons for you to say yes or no. And this is the unit data form. Next slide. And at the end, you'll be asked if you have patients to enter. So some of you may not have patients to enter. So if you press no, you're done with the audit and you can't get back in. So if you do have patients to enter, make sure you select yes. And if you accidentally select yes, but you don't have any to enter, you can just call our Bond Day support email or phone call. Next slide, please. And this is what the patient data forms look like. So at the very end, you'll be asked if you have any more patients to enter, and like it was before, if you say no, the audit closes and you're all set. If you do have more to enter, just say yes and continue until you're all done. Next slide, please. So as far as the next steps, identify the eligibility date for July 2019 audit. Actually, there should be a step before that, is to make sure all your enrollment is all set. That way we can still meet that July 2019 audit window. And then identifying your data collector for each of your sites, starting the IRB process for each site, and reviewing the Bond Day materials in edX, which includes the manual of operations, frequently asked questions, and the unit and patient level data forms. And there's going to be a new upload of the frequently asked questions. Somebody from one of your centers saw that we had made a mistake, and so I need to upload that new one, so that should be done within the next few days. Next slide, please. All right. Does anybody have any questions that I can answer? No? Well, that's all I have. If you do have more questions, please contact me at the email that was on the slide. Thank you.
Yes, and we have our contact information here as well for if any questions about the state collaborative support, business details. You can always contact Pam Ford. My information is up there as the Learning Systems Manager. Once we move into the enrollment phase for the online learning, you'll be working with the LMS registrar here, Brian George. So that's his information. And then, again, Courtney, if you have any questions regarding the Bond Day audits, you can always contact Courtney, and we'd be happy to answer any questions. But now I know that we do have some time for additional questions that are either that people are asking or chatting, and we'd be happy to stay on for as long as need be until the top of the hour to answer those questions.
John, this is Katie.
With Irvine County Hospital.
Go ahead.
Okay, I'm sorry. I was just wondering, and maybe I missed this, do the babies to be entered into the audit information have to have all 3 of the conditions to be entered? They have to be medically treated and...
Yes, all of the criteria. So medically treated within...
I forgot my mute again. Yes, so all the conditions have to be met. So they have to have been discharged during the 3-month eligibility period, been pharmacologically treated, and pharmacologically treated within the first 7 days of life, and discharged during that 3-month eligibility period. So yes, they have to meet all of that criteria.
Okay, thank you.
You're welcome.
Hi, this is Robin Gaffney from Kennestone Hospital. I have some questions specific to the enrollment roster that's to be submitted.
Okay.
Okay. So my question to start with is on the micro lessons. If you had to estimate a totality of time for all the micro lessons, can you estimate how much time all of those lessons combined are?
Yes, It usually takes about anywhere from 5 to 6 hours if you're just charging through them. We have users that, work through them over the weekend if they're just looking to get through all the content. But again, if you're spacing them out and having discussions, I think probably about 16 of the lessons are about 20 minutes long, and then one is about a half hour, and the other one's about 45 minutes.
Okay. Thank you. Follow-up question on the roster. There was mention of identifying on the roster list those that are your core team.
Yes.
Can you walk me through? I'm looking at the template for the roster. How should that be identified on the roster list? I'm not seeing a column
I think you actually have. No, that's a great question, and I think you actually have an enrollment spreadsheet that we had sent out just as an example much earlier on in our initial conversations. So we've actually updated that enrollment spreadsheet. So what the new one will have when Brian reaches out in a little while, in a few weeks hopefully, is that there'll be an additional column to the right, or it'll be very clear that you'll just check, which of those members that you're listing in each of the row, which of those learners will be on your core team. And then anyone who you don't check will just enroll and will have access to the learning.
Okay. Any estimation as to when that new template will be available so that we're not missing any deadline submissions?
No, definitely. As far as looking at it, where the process is that once we finalize the final paperwork and then have the participation agreements, that allows us then to create your center in our system. And at that time, we'll then send out the enrollment spreadsheet. So if everything works and follows along the current timeline that you have, I would think that would be during the month of June.
Okay. And if I may, I think I have one additional question.
Yes.
With the email, are there any advantages or disadvantages to having the email listed for those participants enrolled in the mini lessons, to have that as their hospital-based email or their personal email, just wanting to consider any downstream impact of reports that might be getting pulled based on hospital association, and if personal email would interfere with any reporting or compliance reports that are generated?
Good question, yes. It doesn't matter what emails are used, as long we just need a unique email to enter into for the username. Most centers do use the work emails generally because it's easier. They have those lists already internally from a system with their users and the work emails, so sometimes that's a lot easier to just populate the spreadsheet and get it back to us for processing. But in other cases, if users would like to use their personal email, again, that's fine. They just go on to vtoxford.org/learning from anywhere that they can access the internet, and it'll ask them for their username and password. And their username just has to be one that's unique and one that they're aware of. So a lot of times it's just easier for the champions to use the work emails. So that's the majority of the emails. But we have a fair share of personal emails. Really, it doesn't matter as long as we have something that's unique.
Okay, very good. Thank you so much.
Sure.
And we do have two questions from the chat box. The first one is, as it relates to length of stay, do I include before or after admission to our hospital? And then actually that same question, actually, no, we'll go with that one first.
Okay, so as it relates to length of stay, do I include before?
As it relates to length of stay, do I include before or after admission to our hospital? So So that's a really great question, and I want to confirm that before I give you an answer. I will write that down and check with Dr. Stoll to confirm and get back with you.
Okay. And the second one, and I can send these to you also, Courtney, is as it relates to pharmacologic treatment, do I include any treatment before admission to our hospital?
That's another great question for Dr. Stoll.
Okay.
She's the person who wrote the audit, and so I just want to make sure that I'm giving you the correct answer.
Yeah, yeah. Okay, and then one that I had sent in to me earlier is on the monthly reports for the micro lessons that I believe are sent to me at DPH. Will they show which individuals have completed the lessons, or will it just show an overall percentage from each hospital of the core team?
Yes, it'll show both. It'll start off with kind of the high level, and then it'll just have the attached individual spreadsheets with the individual lesson information for the users, so that then you can view and share that with the center and the champions.
Okay, great. And then another one from our chat box. So if they're watching the lessons, the micro lessons as a group, how can each participant receive credit?
Yes, so what they would do after watching the lesson is that they would then log in and then click on the recorded lesson with their individual account, and then just work through the 3 steps to access the certificates, and then they'd access their certificate at that time.
Okay. And then who do you recommend having as your core team? For instance, should providers of care be a part of this team, or just nursing staff?
Turn it on.
The nursing staff, again, is probably the team that is going to have the most interaction, day-to-day interaction with the champion. But if the champion can consistently communicate, again, it's a 2-year implementation period to complete all the 18 lessons with all the users that are identified as the core team. So if the champion does feel that they can really expand the learning, if they have the ability to communicate, I would say on a monthly basis to all of the learners, it's really who they would feel would really benefit from the curriculum. A lot of times we've had, anywhere from legal advisors to parents view the content. But, as far as a core team, it's really that team that's going to have the day-to-day impact, work through those potentially better practices, develop those quality improvement initiatives. But anyone else, again, you can have access to the learning, but as long as they're not identified as a core team member, again, they'll just won't be on the reports, but they will have access, so they can view the lessons together. They can interact in the ongoing discussions as well. It's really, kind of however you'd like to do it. But we like to say that, we set the minimum at 25 because based on our statistics that we've seen with our previous state collaboratives, that's where 25 or at least 25 core users. But if you're under 25, just have that team that's really going to make the impact.
This is Dr. Levine. With regards to your question, remember that the micro lessons really are just the front end of what we're doing, and it's really advantageous to have physicians on your team, because what you need to do after the micro lessons is to implement new processes to improve your outcomes, and you certainly need to have buy-in from your physicians on that. So it's very helpful to have physicians on your core team, or a physician at least on your core team.
Okay, and how do you prefer we add new staff that may come on board during the project?
So that enrollment spreadsheet that you'll have, you can just add new users to that spreadsheet ongoing and send that on to Brian. If it's 1 or 2, you can always just send it in a simple email with the user's first name, last name, and email. And you can always make sure, it's ongoing enrollment throughout the implementation. So you can always let us know, if users have moved out of the center, if there are new users that are moving in, and we can always add or remove users from the core team as long as you just identify those. So you can keep those enrollment spreadsheets. We always have them in addition if you need to or if you've misplaced it, but we'll just use that ongoing record to help make changes to the any enrollments that you have.
And I have two more that I see. So if a nurse wanted to submit an abstract or write on this collaborative, or I suppose anyone from their hospital, would they be able to use the data from Vaughn?
Yes, I don't see why. Well, Pam, we have Pam here.
Hi. Well, I guess I just would need some clarification. This year we're not accepting abstracts, just posters. So are you talking about doing a poster for the annual Quality Congress? Or I guess I'm not sure.
I think the question might have been broader than that. So just I think, I guess thinking about it, you know, from the data that they're getting from the Vendée audits, would they be able to publish that anywhere?
I would defer to Courtney on that.
I will double check with Dr. Saul, but I think it's basically your data, and as long as you say where you got the data from, I believe that's the only qualifier that we request, that you just include Vermont-Oxford Network in the references. But I'll double check it with Dr. Saul.
Thank you. And then the last one that I have, unless others on the phone have questions, is can disciplines other than physicians and nurses obtain continuing education credit for completing the micro lessons?
Right now we just have medical and nursing available. So those are the only types of credits that we do have. But again, as long as the content is available, you know, depending on the position, just the curriculum might be valuable. But right at this moment, we have nursing and medical available for the learning.
Great. Are there any other questions from people who are on the line?
This is Brittany Smith from WellStar. I just wanted to clarify, because we're enrolled as a system for the Center for Excellence, if we need 25 core staff per facility or 25 core staff for our entire system.
I think it's the system. We just have to double check what would be submitted for the. But I think it's the system. Pam and I are.
Well, I think it's the center, each center.
Yeah, I think each center for the system, right?
Well, that's what I would.
Yeah, it would be if we set up each center within the system as its own center, then it would be center by center. So it really depends on how it's set up. But we'll have to look at that. Because I don't have that information, unfortunately, right in front of me.
I mean, my sense is, and we can check on this, but it wouldn't be 25 people for the Piedmont group. There'd be Piedmont, various Piedmont centers, and each one of those centers would have their core enrollees. So that would be my take on it, but we can double check. And I do think, just another point, when we were talking about the core group and who should be on it and so on, and John was indicating nurses and David was saying physicians, and all of that's true, but I think it's also important as a Von champion that you have a conversation beforehand to determine who should be in your core group, because you certainly don't want to be including people that are just going to be not able to complete the lessons or not be as involved. So having some of that in the background before you actually submit the enrollment sheets to have your team in place would be very helpful too.
Absolutely, I totally agree with that, Pam. But there's a whole spectrum of people it would be optimal to have on your core team if they would be engaged and participate. Lactation and family and all kinds of folks. But as you said, you want to make sure they're going to be engaged.
Right, and I mean, we have in the past had even people that aren't specifically affiliated with the center, but maybe a midwife in the community that you want to enroll and involve, that's perfectly fine too. You just need to let us know. And you know, depending on whether you want to do Center of Excellence or not is certainly up to you. But really, we want to make sure that the learning is as broad as can be so that you can enroll as many folks as you want, because anyone who's involved with the NAS infants should have access to the materials.
And you can also think of your core team as kind of your experts, or, you know, those people who will ultimately be, I guess, trainers themselves. You know, they'll become the super users and can also work to expand and engage the curriculum with others as well. And just to mention, too, about the core team, something Pam and I always talk about it, it's also always good for them to know who they are, but anyone who's being enrolled in these lessons, it's good to communicate with those people, because sometimes we do get some emails from people wondering, why did I get this, you know, enrollment email from us, and what is it all about? So it's very good to make sure that whoever you're putting on that enrollment spreadsheet knows that they're being put on the enrollment spreadsheet and will receive access and a little bit of an overview. So we'll have, again, the shorter videos that we'll email that kind of reviews the login process and the lessons that you can let them know as well.
And John may have already made this point, but optimally, we would have the Vaughn champions have access first to actually go through the lessons, to look at all of the wealth of information in the facilitator's guide and in the toolkit, so that they really are the super users and the champions, and the folks saying, you know, oh, make sure that you do this by this time, and so on and so forth. So the sooner that we can get, I know we aren't quite there yet, but the sooner that we can get all that information, get everybody started, the better.
Okay.
Well, there's 2 minutes left, and I would like to thank John and Courtney and Pam for your participation on the webinar and for all the help you're giving us for this initiative. I would like to remind folks of what they need to be thinking about and doing. They need to be assembling a team and identifying who their champion's going to be. They need to be looking for the new enrollment template and get folks enrolled for the LMS. Need to be thinking about your SMART aim. Now, the SMART aim for the collaborative is going to be to reduce length of stay by 10%, but you'll all have your own aims as you look at you may look at a gap analysis and look at what you need to improve. And then the next webinar is going to be what date, Katie?
Sorry, I was on mute. I believe it's June 11th.
June 11th.
Yeah, it'll be the second Tuesday of every month at 2 p.m.
And the topic will be?
So that one will be going over the hospital discharge data and the quarterly data reports that you'll be getting from us.
All righty. Thank you.